Hi, I'm Dr. Tiwari, and this is the best podcast ever. As a board-certified plastic surgeon, I've helped patients from all over the country navigate breast surgery, from reconstruction to aesthetics. But this podcast goes deeper. We're talking longevity, biohacking, recovery, and the personal stories behind it all, so you can better understand your options and feel more in control of your health and your body. All right. Well, hello, everybody. Welcome to another episode of the Best Podcast Ever. We are very, very excited today to speak with Dr. Steve Williams, who has an incredible resume. I've known Steve, actually, believe it or not, for 27 years. When we were both in training, I was doing my sub-internship at Yale Medical School. Steve went to medical school there, if I remember correctly, and was an intern in surgery. So thank you so much, Steve. Do you want to introduce yourself and tell our folks about who you are and, why we are talking today, because there's so much to talk about.
Yeah, my name's Steve Williams. I am a board-certified plastic surgeon. I practice out here in Northern California. I am the president emeritus of the American Society of Plastic Surgeons. I finished my term about 2 years ago now, and I've known Dr. Tiwari for essentially decades now.
That's crazy.
It is crazy. We share a passion for plastic surgery and for the betterment and safety of our patients and the furtherance of our profession.
So, Steve, you may not remember this, but one of the first free flaps I ever saw was at Yale during my sub-I, and you were, the intern resident on the case, and I still remember that as my very first exposure to free flap surgery. That's now essentially what I do all the time is, DIP flap reconstruction, all types of reconstruction, but that whole area of interest started with you back in the late 90s.
Well, I would love to take credit for starting microsurgery, but it's great that we had that shared moment and that exposure together. As you very, very well know, plastic surgery, one of the reasons that people like yourself and me, we go into plastic surgery is because of innovation. And microsurgery is one of those things that was plastic surgery innovation, and it's been transformative for how patients get care, for how patients recover after trauma, after different types of cancer. It's just been an incredibly revolutionary field that started with plastic surgery.
Yeah, and I think the innovation space in plastic surgery is something that is very, very hot right now. There's so much going on that I would love to be able to tell our audience about. And we're so lucky to have you at the forefront, at the vanguard of some of these innovations with your experience at ASPS. So we talked a little bit about what's going on in breast augmentation and reconstruction as far as new innovations. Tell us about what your experience has done to you in terms of your practice, what you're seeing out there, what we should be thinking about here in Columbus, Ohio, middle of the country.
Yeah, and again, the wonderful thing about plastic surgery is it doesn't really matter where you are in the country. We all feel the same level of innovation. We all bring the same expertise and level of care to our patients. And so that's the wonderful thing. It's like San Francisco, Columbus, Ohio, it's all the same thing. We're still approaching our patients the same and trying to provide the same excellent care. As you know, I think one of the interesting things that's happened in terms of breast reconstruction and in the breast implant space, and implants are still a large mainstay for breast reconstruction. I personally prefer autologous tissue when I was doing more breast reconstruction, but implants are still the mainstay of how most patients experience breast reconstruction. Mentor has come out with large size implants. For such a long time, yeah. The FDA limited the size of implants that were there. 800 cc's was really the maximum volume. And for a lot of my reconstructive patients, that wasn't enough. And so the fact now that we have larger implants have really changed kind of what patients can be offered, which is fantastic.
Yeah, I recently used one of these Mentor extra-sized implants on a patient who had had a D-flap on one side, implant reconstruction on the other side, and we never quite got there in terms of her symmetry. And I have to say that this oversized implant really hit the mark and gave us exactly what we needed for that patient. So yeah, it is definitely a game changer in what we're seeing in terms of sizes of implants. I'm also curious on your take on the new Motiva implants. It's something that we're hearing a lot more about. What is the Motiva implant, and have you had experiences with them?
We have, and so we were one of the first practices to have access to Motiva implants. And I know JJ, the former CEO, still on the board of directors, and very close to a lot of the people there. And again, one of the things, kind of the constant thing that people talk to me about or that I'm interested in is innovation. And, Motiva really has tried to bring new things to the market space. And so for us, we're largely an aesthetic practice right now. And we have a large number of patients that are seeking Motiva implants largely because if they've had issues with CapCon, there's some science that shows that Motiva's new surface may decrease the chance of capsular contracture. And so in some of those patients who have had recurrent capsular contracture, it's now something else we get to offer them. And again, not that textured implants are a new science, but I think that they've done it a little bit differently, trying to augment the overall safety, but still have the solution of lowering the incidence of capsular contracture, which is, especially in reconstructive cases, but in aesthetic cases as well, significant consideration for patients when they're thinking about breast augmentation or breast reconstruction.
Yeah, so for our audience who may not know, the Motiva implants are what's known as a micro-textured implant. Is that correct?
That's correct. They refer to it as a surface. They don't like the term texture because,
Got it.
again, there have been some issues with previous generation of textured implants from other companies.
Yeah, and it brings up, of course, the concern of ALCL lymphoma. We've seen that among some textured implants. The Motiva surface is quite different, I have to say. Have you used it in more the subglandular space or the submuscular space for your augmentation patients?
It's so funny that you asked that. I generally don't like subglandular placement. I'm generally either a subpack or dual plane type of person. And again, for the audience, we're talking about the positions of the implant. And when breast augmentations were first done, almost 80, 90 years ago, the consideration was putting the implants over the muscle because that's actually one of the easiest, most straightforward planes. It's the least recovery for the patients, the least pain. But then capsular contracture and palpability of the implants and appearance of, a kind of an unnatural shape kind of pushed people to figure out other techniques to improve the overall look. Texturing was one of those things that came out from that innovation. Putting the implants underneath the pectoralis muscle, this chest muscle that people have, was also another. And the bulk of breast augmentations and breast reconstructions are still done under the muscle, but there's this new wave now, and Motiva implants are kind of empowering a little bit of that to kind of consider going back over the muscle. And so generally, I would say 99% of my cases are still subpectoral or dual plane, but I did had a patient who was very active in weightlifting and bodybuilding, and she was really concerned about an animation deformity. And she was very, very insistent that we go above the muscle. And so we talked about Motiva as a solution to decrease her chance of getting capsular contracture, but still give her that look she wanted. And it worked out great. She's super, super happy and kind of reinforced the fact that as we move forward with innovation, sometimes those innovations make older techniques possible, again, in the right situations.
Yeah, I think it's very interesting because, one reason we tend not to perform subglandular augmentation is the risk for capsular contracture. And if the Motiva is able to decrease that risk, I think that would be a bit of a shift in how people are approaching breast augmentation. So I think it does yet remain to be seen how this will play out, but I do think it's a very interesting innovation, very interesting technology that they've brought us. Speaking of technology, you are in San Francisco, you're in the hotbed of technology. All we do is talk about AI all day long in different spheres of our lives. It's become so prevalent in so much of our everyday. I'm very curious to get a sense of your thoughts on how AI, how artificial intelligence is going to impact the practice of plastic surgery and impact our patients.
Yeah, again, if you flip open a random newspaper, there's going to be a story about AI. That's kind of all the rage right now. And especially out here in Silicon Valley, there's tons of money pouring into the space. There's tons of discussion of disruption of different industries. And like everything, we'll kind of see how things settle out. But there are some really key differences and some impacts that we're already seeing in terms of AI. I think one of the most obvious for our patients, whether it's aesthetic or reconstructive, is somewhat in how either you're finding your physician now, how you're finding your plastic surgeon, or how you will find your plastic surgeon in the space within a year. And Dr. Tiwari, I'm sure that you kind of know this as well. In the not so old days, 3 or 4 years ago, you would go to Google and you would type in best plastic surgeon for breast reconstruction, best deep flap plastic surgeon. And, you're a great surgeon with a great reputation. Your name may pop up. If you're in the aesthetic space, you're probably paying Google to do some marketing so that your results may come up above that. And That can be good and bad. Sometimes it helps patients to find what they want, but sometimes they're just flooded by spam or by people who are underqualified or maybe not the best, but they pay Google to tell them they're the best. The secret here is Google has always known how to give people better answers, but it hasn't because it wasn't really their revenue model. And so AI has really turned that on its head now because now people are able to ask that same question in AI and get a much more organic answer. When people say, oh, well, I'm not really into AI and AI hasn't touched me yet. If you're using Google, AI is already touching you because Google recognizes that the old way of doing things, and again, old 2 years ago, isn't working anymore. They're giving you, most of the time, they're giving you the AI answer already. And that's a dramatic shift about how those answers are being generated, what data those large language models are using to assemble that answer. And so that's already kind of the first shift that I think patients are experiencing.
Yeah, it's so interesting because I think that you're 100% right that the way patients are going to find the right surgeon for them, the person that is the right fit for them, is going to be through AI tools that allow you to ask very pointed questions in terms of a surgeon's expertise, their background, and do it in a way where it's more proactive and less kind of reactive, where I feel like Google in the past has been a bit of a reactive. Google tells us, here we now have a chance to really ask questions that allow you to pick your surgeon, pick the right type of maybe even operation that people are then going to move forward with. So it is a game changer. AI for us in the practice of plastic surgery, I think has also been a game changer in terms of the ability to interface with insurance companies, interface with patients, chat tools. All these things are they're changing the landscape of what it is to run a plastic surgery practice. I think it is confusing, but I think in general, these are very powerful tools that are going to make patient accessibility and communication that much better. And I'm sure you'd agree, I think the best patient is a well-educated patient.
Percent. And, there are issues with hallucination. There obviously will be attempts to manipulate AI, for various economic interests. And, we do have to think about things like, sometimes AI comes up with very strange answers when it comes to medical issues. And so there have to be careful guardrails on that. The second point that you brought up is really the second kind of part of this evolution. There's a difference in the way patients find us, but now there's also a difference in the way that we're able to interact with patients. We're able to be much more responsive. We have AI bots that interact with patients after hours in a very, again, protected kind of guardrail type of way. We are able to, and I'm sure you're using this as well too, we have agenic bots that listen to our interactions with the patients while we're doing interviews. Before patients get too concerned about this dystopian future, what it means that I can actually listen to you. I can actually respond and interact with you more effectively because in the background, there's an AI bot that's listening and taking and creating the charting and the note and making sure we're not missing any of the critical medical points. And that really means that we have a better interaction with our patients and are really able to spend more time talking to the patient and less time charting. And that is transformative as a doctor in kind of this generation. One of the major sources of burnout is physicians having to do all this administrative work. And so AI is great at a lot of that.
I always think of, this is another little anecdote. You may not remember this, but I certainly do. I think you were the first person I'd ever met with a cell phone way back in the day. You were always ahead of the curve. And I remember the cell phone was this really big thing. And, back then we were using pagers. And it's so crazy to think about in our lifetime, which is not that long, we've gone from, excusing yourself at dinner because you got a page and using a payphone to now AI chatbots answering questions for you. I mean, it's really incredible.
Technology is wonderful. Yeah. And just to further that story, I'm so old that at Yale, the medical students, each class makes fun of the class above them. Like the class underneath me, I was a character in their annual skit making fun of the fact that I
remember this.
Remember?
Because you may not remember that my wife was a year, I think, or two under you in medical school.
That's right. And they're like, nobody needs a cell phone all the time.
Right. Little did we know how far ahead of the curve you were back then.
Not on purpose.
Speaking of innovation, one of the greatest innovations, I think, in our lifetime, not just in plastic surgery, but in the field of medicine, is the GLP-1.
Oh my gosh.
It is just an incredible change in people's metabolism, their body mass indices, the ability to deal with resistant type 1 or type 2 diabetes. I think it really is a true paradigm shift in medicine. And I know you have a med spa. We have a med spa. It's a big part of what we do in the med spa. Caitlin is our PA who runs the med spa, so a little shout out to Glowlux. But what have you seen with the GLPs? Because I just find it so profound.
Yeah, we've always had a med spa as part of our clinical practice, and traditionally for patients or interested physicians, those have been used to augment some of the procedures we do to make sure we're able to provide care in terms of neurotoxins or lasers for patients in between surgeries. But a few years ago, when GLP-1 medications became available to us, we realized that we had the ability to transform patients' health as well too. And these medications, the reason that, like AI, if you open a newspaper, that's what you're reading about, is because as you've mentioned correctly, these are transformative medications. For the first time, the BMI, the body mass index in the United States, is going down because these medications are effective. For the first time, we're seeing a decrease in obesity, and that means that America is going to be healthier. That means that patients are going to be healthier. For plastic surgeons, it's great because we want people as close to their ideal body weight as possible because it lowers our complications. It means they get better results from an aesthetic or a functional aspect. And so it affects reconstructive and aesthetic plastic surgeons. And so I've been a huge advocate in plastic surgeons really taking ownership of this medication and employing it for our patients for their overall benefit. But it's so transformative that, again, companies food companies are restating their earnings. Airlines are restating their earnings, so they don't need as much fuel now because people are lighter. I mean, it's just going to be really, really interesting. And I've been asked to speak around the globe on this topic. And one of the things that's a little bit interesting, and I'll just kind of drop this, and it's a very controversial thing that I say, so hopefully controversy is not too big a problem on your podcast, but it eventually may be the end of plastic surgery in some ways. And I think when I say that to plastic surgeons, everybody kind of furrows their brow and say, no, because people are losing weight and then they have loose skin they have to manage, or people are healthier and it means that there's a bigger access to plastic surgery procedures because we want to operate on healthy people. But what it really, really means is people are going to be healthier, and becoming a physician of any kind takes a long time. If you're going to be an OBGYN, it takes a long time. If you're going to be an orthopedic doctor, it takes a long time. And these medications are transforming the health of the United States so quickly that you're not going to need as many doctors eventually. You're not going to need as many OBGYNs taking critical care, care of critically obese pregnant people. The orthopedic doctors aren't going to be needing to do as many knee and hip replacements. And there's going to be a glut of doctors, especially in kind of these larger conglomerated medical healthcare systems. And that means that those doctors aren't going to have jobs. And guess what happens to an OBGYN or an orthopedic surgeon that gets laid off by Sutter or Kaiser? They don't go run a Denny's. They say, how can I continue to be a doctor? And a lot of times that means coming into the cash pay aesthetic space because states don't regulate what doctors can do. And they may not be able to do these operations in hospitals, but they can definitely open up an office in the back of their practice and do some liposuction. And we are such a small practice. It doesn't take very much of that to be very, very disruptive. And so that's my one controversial thing I'll say about the
No, I
GLP.
think that's I've never really kind of put those dots together the way you just brilliantly elaborated, but I understand what you're saying. I think the GLPs are a two-hit wonder drug, diabetes and obesity. And, those are epidemics in the West. And the ability to address those, last I had heard something like 10% of America is on some GLP.
Yeah,
and
which
it's
is
fast.
that's a
That's 25
gigantic.
million people. It's almost 30 million people. And the ability to really, really, truly move the needle on what I think really is the biggest morbidity that we see um, on an everyday basis, which is downstream effects of obesity, whether it's chronic joint issues, cardiovascular issues, glycemic issues. I think the ability to address those, it really is a game changer. This brings up scope of practice, as you've rightly pointed out. And I know this has always been a concern for ASPS, but it sounds like based on your experience and your tenure, this is something that's going to be a continuing issue that our society has to address.
It's a global phenomenon, really. It's the one thing that I think unites plastic surgeons. we're highly trained to take effective care of our patients. And it's something that I know that you have worked very hard to train and to keep yourself updated and to provide the best care for your patients. And sometimes, not all the times, but sometimes when other people are coming into that space for economic reasons without that same training, patients can suffer. And so it's kind of a one-to-one. I think being a plastic surgeon is the best kind of medicine that anyone could ever do. So I understand that draw and the desire for maybe the ER doctor or the OBGYN to kind of step into our sphere, but they should just go back to residency and get some more training. I mean, I don't begrudge them wanting to be in this space. They should just do it in an ethical way that's going to protect patients and give the best care.
Yeah, and to your earlier point, I think AI does identify a tool that allows patients to vet their surgeons appropriately. So, it's interesting how these topics are related.
Yep.
One thing I always asked our guests on the Breast podcast ever is tell us a little bit about you, your everyday, what gets Dr. Steve Williams up in the morning, gets him excited, gets his energy up, what is it that makes you tick and do all the things that you do?
Yeah, obviously, again, I have the best job in the world. I love taking care of patients. I love the variety that plastic surgery has. I think, like all of us, sometimes our careers and professions get all consuming. And so as I'm getting older, I'm trying to think a little bit more about taking time for family and having a little bit more balance. Although I've typically characterized for the residents in the world that may see this, they know that my lectures are generally emphasizing the importance of less balance, at least during residency, because it's a very special time to train in a protective environment and learn what your limits are to best take care of your patients. And that has to be the overall priority. But I think the thing that I'm really looking towards is building systems, building relationships. The nice thing when you kind of get towards a little more of a senior point in your career, and like you and I are both getting there, is you get to interact and work with people to build things that you like. You surround yourself with people that you respect and you like. You don't have to necessarily be around people that you're not as impressed by. And so, one of like this podcast, for example, it's an honor to kind of catch up with you and see your wonderful progress. And it's because I want to do it, and because I think that you're an outstanding plastic surgeon. And that's kind of what my life's like right now, is just starting to do some of the things and interact with some of the people that I want to instead of the people that I have to.
I love that so much. Let's finish up with a Breast podcast ever speed round.
Okay.
San Francisco or LA? I knew that was coming. You may
I
not
like
know
LA.
this one, but Buckeyes or Wolverines?
Wolverines. Sorry.
Ooh, that one
I
hurts
know. I'm
bad.
sorry.
Well, Steve, Dr. Williams, thank you so much for being a guest on the Breast podcast ever. This was a treat, on so many levels for me. It's a great honor to be able to talk to you. It's wonderful kind of bringing this all together after knowing you for many years. Congratulations on all your success and everything you've done for our specialty. And I wish everybody to please check out Dr. Williams on social media. I think there's a ton that you'll learn from him. And again, thank you for tuning in to the Breast podcast ever.
It's an honor to be here, Pankaj. I really appreciate your time and your expertise and all the great things you're doing for your patients and for plastic surgery. So thank you. It's an honor.
Thank you. Thanks for listening to the Breast podcast ever. If you found this helpful, be sure to subscribe and share it with someone who might need it. You can follow along on Instagram at MWBreast and learn more at MWBreast.com. We'll see you next time.